Hi everyone, it's Trace here, the humorous tutor, and this video, getting straight into it, is part 4 of 4 of the osteology of the skull. So first let's imagine we've removed the calvaria, the roof of the skull, and we're looking downwards or at a superior view of the cranial floor. So basically, this is where the brain would sit. And of course, to orient ourselves, we have anterior or the front towards the top of the screen there. And what we're really looking at when we're looking at the cranial floor is 3 cranial fossae put together, and they're very aptly named. So first of all, we have the anterior cranial fossa, and this is the shallowest of the 3, and it's going to hold the frontal lobe. Bounded anteriorly by the frontal bone and posteriorly by kind of just following the lines of the lesser wing of the sphenoid bone. The cranial floor of the anterior cranial fossa is made up of the orbital plate of the frontal bone, the cribriform plate of the ethmoid bone, and also the lesser wing of the sphenoid bone. Now then, posteriorly from the anterior cranial fossa, outlined in red here, we will find the middle cranial fossa. I really love how these are named. And so in the middle cranial fossa, we would expect that to hold the temporal lobes of the brain, and of course the parietals will sit a little bit more superiorly to that. Anteriorly, the border will be the same as the posterior border of the anterior cranial fossa. Sorry, that could have been a bit confusing. So basically, the border, the back of the anterior cranial fossa and the front of the middle cranial fossa will be at the same point. And so the middle cranial fossa, that floor, is composed of a majority of the portion of the sphenoid bone and also the squamous and the petrous portions of the temporal bones on either side. And then posterior again to the middle cranial fossa, we find the posterior cranial fossa, and that will be composed of a very small portion of the temporal bones, but largely the occipital bone there, and that will hold the cerebellum and the occipital on top of that. Now moving on to the cranial foramina, so the holes that we find at the base of the skull, these will transmit nerves and blood vessels largely. And so starting here at the base of the sphenoid, or the greater wing of the sphenoid bone, we have the slightly larger foramen ovale, and it is indeed oval in shape. And the foramen ovale here is going to transmit the mandibular nerve, so that is the 3rd branch of the trigeminal or cranial nerve 5. It'll also transmit the accessory meningeal artery. Now a little bit posterior to that and a bit smaller as well, but still on the base of the greater wing of the sphenoid, we find the Foramen Spinosum, and that'll transmit the middle meningeal arteries and veins, and also the meningeal branch of the mandibular nerve, so denoted here as V3. Now on the other side, I want to draw your attention to 3 quite large foramen. I say on the other side just because I've run out of room. On the right hand side of the screen, all of these foramina are found on both left and right. So here, first of all, most anteriorly, we see this really large jagged hole, and that's formed between the temporal and the occipital bones, and that there is the Foramen Lacerum. So the Foramen Lacerum, or the lacerated kind of hole, is generally covered in connective tissue on the outer surface, but it will still, on its own, transmit the greater petrosal nerve. The next arrow down is the Carotid Canal, and in the name, it will transmit the internal carotid artery, which is vital for supplying blood to the brain. Now, the internal carotid artery makes several right angle turns as it makes its way from the heart to the brain, and the carotid canal is one of these places in which it does that. So because we're looking at an inferior view of the skull, imagine that we have an artery traveling superiorly towards the brain. It will enter the canal, at which then it will take a right angle turn medially and make its way towards the Foramen Lacerum, and at the Foramen Lacerum on the inner surface there, it will then make another right angle turn and make its way superiorly to supply the brain. So we had the internal carotid artery supplying the brain with fresh oxygenated blood, and so that's going towards the brain. It's not as clear on this view here, but the jugular foramen, that's a little bit more posterior to it, is much larger and looks more like a cleft than a canal. And so the jugular foramen will transmit cranial nerves 9, 10, and 11, which is the glossopharyngeal, the vagus, and also the accessory nerves. And it'll also then transmit the internal jugular vein, which collects a very, very large portion of blood, draining the brain back towards the heart. A couple of little foramina worth mentioning as well. So here first we're looking at the Stylo Mastoid foramen, which makes sense. It's just posterior to the styloid process on the mastoid portion of the temporal bone, and that is going to transmit cranial nerve 7, which is the facial nerve, and also the styloid mastoid artery, which I think is great because that's easy to remember. And then we also have the mastoid foramen, so that's very much on the posterior portion of the temporal bone there. And the mastoid foramen allows passage of the mastoid emissary vein and also the posterior meningeal artery. And looking on the occipital bones, first we find the occipital condyles. Remember those rounded processes that help to form the atlanto-occipital joint. And just posterior to the condyles, we're going to find in half the population the condylar foramen, and that will transmit the emissary veins and also the meningeal branch of the occipital artery. Now, once again, looking at a superior view of the cranial floor, let's identify some of the same foramina in this view and also a couple that we couldn't see previously that we should be able to now. So let's start first of all, let's kind of work our way anterior to posterior. And first we identify the ethmoid bone, which is kind of very close to the orbital plate of the frontal bone, and we see all of these tiny little holes, like little pores kind of, if you will, in the cribriform plate, and they are our olfactory foramina. And so in the name, the olfactory foramina, they will transmit cranial nerve 1, the olfactory nerve, specifically the filaments of which as they enter the brain, and also the anterior ethmoidal nerves. Then also in the lesser wing of the sphenoid, we can see the optic canals, and that will transmit cranial nerve 2, the optic nerve, and also the ophthalmic artery. Now, the cleft between the lesser and the greater wings of the sphenoid is called that superior orbital fissure. And this fissure is quite a large space, so it will allow passage of quite a few things. And the way that kind of helps me to remember what goes through here is literally what bones and what am I going to find on the other side that the brain needs to supply or innervate. And so keeping this in mind, we're going to find the lacrimal and the frontal nerves passing through here because the lacrimal apparatus and the lacrimal bone is there, and also the frontal portion and the frontal bone is up there, so all good. And we're also going to find the superior and inferior ophthalmic veins. Makes sense, ophthalmic means eyes. And also, of course, the 3 cranial nerves responsible for motor movement of the eye, which are 3, 4, and 6. Oculomotor, trochlea, and the abducens nerve, respectively. And because, classic me, I've run out of room on the right, I'm going to draw in 3 foramina of interest on the left there. First of all, we start with the kind of more medial and more anterior foramen, and that's the Foramen Rotundum, and that's going to transmit the maxillary branch of cranial nerve 5, the trigeminal. And then we once again see the foramen ovale at the base of the greater wing of the sphenoid, transmitting the mandibular branch of the trigeminal nerve, which makes sense if you get to see it in a skull. The foramen rotundum actually does sit a little bit more superiorly, whilst the ovale sits a little bit more inferiorly, and that would make sense because the maxilla and the mandibular are going to sit on top of and underneath, respectively. So that kind of makes sense to me. And then here in this view, we also see the Foramen Spinosum, and that will transmit that middle meningeal artery and vein, and also the meningeal branch of the mandibular nerve. And here, once again, in this view, we can see the Foramen Lacerum. Remember it being kind of like the hole that's found at the junction of the sphenoid, the temporal, and the occipital bones. And a little bit more posterior to that, very much within the temporal bone, we find the internal acoustic meatus, and that will transmit cranial nerves 7 and 8, which are facial and vestibulocochlear, and it'll also, it's actually quite a large passageway, this meatus, and it'll also hold the vestibular ganglion and also the labyrinthine artery. And I'm very quickly running out of room. Here we can see in this view, I think it's better shown in this image here, the jugular foramen, how it really is kind of like a larger kind of jagged shaped cleft, and we already went through what travels through here a little bit earlier, and we'll finish off just quickly on the medial portion of the occipital bone. We find the hypoglossal canal, and in the name it will transmit the 12th cranial nerve, the hypoglossal nerve. And that's it. That's all I will talk about in this particular video. We've just really gone through the anatomy of the cranial floor, the cranial fossae, and the cranial foramina and what runs through them. I hope that made sense, and I really do recommend picking up a skull and having a look at these features for yourself. And until then, thank you very much, and see you next time.